Hello, my name is Larry Dobro. I'm the senior editor of MM&M magazine, and I'd like to welcome you to How Doctors Socialize Online, Medical Crowdsourcing in the Virtual Doctors Lounge, which is our most recent webcast. Our featured speaker today is Osnat Benshoshan, who is the Senior Vice President of Marketing and Strategy at Sermo. Prior to joining the company, Osnat founded a strategic marketing consultancy where she relaunched biotech and healthcare brands. Osnat brings a decade of pharmaceutical brand management and award-winning marketing experience, having worked at both Amgen and Bristol-Myers Squibb. Prior to that, she also held both PR and marketing research consulting positions in the healthcare field. Osnat graduated with a degree in pharmacy from the University of Montreal. I'm going to turn it over to her right now. Please feel free to submit questions in the Q&A part of the online conference room. And Osnat, looking forward to hearing what you have to say.
Thanks so much, Larry, for the introduction, and thank you all for your interest and presence. With me on the conference, I have our Director of Community, Christian Rubio, as well as Kim Frederick Schneider, or we call him KFS, our Head of Engagement, who will join us in the Q&A at the latter part of this. So today I'll talk to you about why doctors find social networks valuable and a movement that we here at Sermo are fiercely passionate about. That movement is medical crowdsourcing, and we'll touch on why we believe this has the potential to transform medicine and why it's meaningful to all audiences who want to engage with doctors today. So just a few words about Sermo, which means conversation in Latin. And conversation is really the essence of our brand. The deep, rich, authentic conversations that we have on Sermo is really what makes Sermo so unique. So Sermo was the first social network for doctors. It was founded a decade ago, and today it's the leading and most trusted doctors-only social network in the U.S. In a few days, we start our international expansion with the U.K. as our first country, very exciting, and our goal is to become the leading global social network for doctors with close to 1 million doctors by year's end. So today I'm going to touch on two concepts: what doctors do in a virtual doctor's lounge like Sermo, as well as the new disruptive phenomenon of medical crowdsourcing, which is one of the most important reasons doctors are gathering online in social networks. So who is the Sermo doctor? Our gender profile breaks down into about 75% male, 25% female. Of course, he's typically a good-looking doctor like the one picture here. 40% of our doctors are PCPs, 60% are specialists. They've got about 15 to 20 years of practice. They represent 96 specialties and subspecialties practiced in all 50 states, and 60% are logging in via mobile. So this here is, what this shows you is simply that we index very closely to the AMA. That means the distribution of doctors in our network is very close to the distribution of doctors in this country. The demographics and the years of practice are the same. So what we're trying to say here is that the social network doctor on Sermo is the everyday doctor. We're not dealing with outliers or a bunch of retired doctors who have time to chat. So to what extent, the big question that many people have, are doctors socializing online? Well, doctors and Americans are on social media at the same rate, but only 40% of doctors use social media professionally. So why is that? Why aren't doctors more social? This quote just says it all. This is one of our members, and he says, "Doctors are paranoid creatures today. Everything is discoverable. There is no upside to saying something that will live forever and get you into trouble with the institution you work for, insurance companies, government, or a potential lawsuit in the future." So an environment of trust is absolutely critical for doctors to be able to socialize online. So when they do socialize online, where do they go? Well, about a third use LinkedIn. Slightly less than that, 29% use professional social networks like Sermo, 20% on Facebook, 10% on Google, 8% on YouTube, 5% on Twitter, and 1% on SoundCloud, and they use it for different purposes. There's actually 3 important trends influencing physicians and their use of social today. And those three are: doctors are way busier, doctors are way angrier, and doctors see fewer reps and are less responsive to promotion in general. So let's talk about the busier part. I think we'd all agree that doctors are some of the busiest professionals we know. And with the advent of all the recent healthcare changes and all the new requirements piled on them, they've become even busier. So this is what their day looks like. Those 13 hours consist of about 8 hours a day seeing patients, 5 hours completing electronic health records, insurance forms, and paperwork. And throughout the day, they've got about another hour and a half that they spend online using digital resources for work. Another important trend is the increasing rise of the no-see doctor. According to ZS Associates, close to half of all doctors in the U.S. are now access restricted in some way, shape, or form. So that means today many marketers are trying to reach doctors in that precious digital hour and a half. So what's your challenge with doctors? We'd say it's time, access, and influence. Doctors are generally less responsive to promotion, so how do you get their time? How do you access them? And most importantly, how do you influence them? The third aspect that's fueled the popularity of the social movement among doctors is their state of mind. In the U.S., these people are generally not very happy today. The way they work has had to change dramatically. They now have electronic medical records to complete. There's more accountability, less pay, more certification, higher liability. So they've never been more stressed out, more disenfranchised and angry. And as a result, many are feeling isolated and disconnected from one another. Another great quote summarizing that state of mind, and this doctor says, "We're angry at organized medicine, healthcare reform, and the general lack of respect. There's too many things required of us, and we're feeling beaten down." So it's no wonder doctors are increasingly gathering online in the virtual doctor's lounge. Another great quote: "There's never been a time like now in history when doctors have needed a meeting place to unite, to talk, to feel like they're going through the same thing." So what exactly is a doctor's lounge? And the doctor's lounge, as described by one of our members, used to be a great meeting place for doctors, a place where only doctors could go to share the stresses of everyday practice and discuss medical cases. These days, she says, they don't exist, or there's just no real time to go there. So just a few fun pictures to show you. Even way back, doctors have had a place to decompress from the daily challenges of being a doctor. Of course, the doctor's lounge has evolved, 50s, the 80s, more like today, and more like today in the few hospitals where they are still around. So the lounge is a place to relax and connect with one another, both socially and professionally. It's a private inner sanctum where only doctors are allowed, and a place where they can share the stresses of this unique profession. It's a job. It's a very difficult job, right? I think we'd all agree. It's a job where on a daily basis they have other people's health and other people's lives in their hands. And so doctors, in my opinion, truly are an extraordinary group of people to have chosen that profession. But as I mentioned earlier, those doctors' lounges have disappeared, or the few that exist are pretty empty, as these doctors simply don't have time to stop by. So today, this is what the doctor's lounge looks like. Just as they would in a real doctor's lounge, doctors are stopping by in this giant virtual room, popping in and out at different times of the day from different parts of the country and now the world. And they're talking with one another, they're joking with one another, and they're talking about everything from the practice to the business of medicine. The great thing here is that doctors do make deep, strong personal friendships with one another. And when they feel safe and comfortable, that's when they consult each other clinically, and that's where the magic starts to happen from a clinical perspective. So speaking of clinically, You can imagine this scene as if it were in a real lounge. You see this one doctor saying to the other, I had this crazy case of a saw blade through the thumb, and I wasn't sure what to do. What would you guys have done? So this is a clinical case on Sermo. You could see all the peers answering in the comments section at the bottom right. There's a bit of gray there. But what's unique and what's fun is if you just look up, you can see the poll right on the top. And this is something that can't be done in any other doctor's lounge or any other doctor social network. Doctors can actually poll other doctors. And here you see the doctor asking 78 peers what they would do. He created the question, he created the case, he then created the poll question, and then he created the answer choices. And he's got 78 voters. Again, you couldn't do that in a real doctor's lounge. And what's also unique is now Sermo is globalizing. So besides the 305,000 potential doctors in the U.S., there's another 38,000 in the UK to interact with, and by the end of the year, many more countries. So we talked a lot about the doctor's lounge and the social aspect of it. But the true value of a global doctor's lounge is the ability for doctors to really improve healthcare by actually learning from one another. So for those who think a doctor's lounge is simply a hangout for doctors to decompress, it isn't. Doctors, they need the lounge to feel comfortable with one another, not only to share their true feelings, but to also ask for help, advice, and second opinions from their peers and their colleagues. And it's in that environment, when they're comfortable, that they confide in and they learn from one another. And this doctor says it great. He says, I've learned more on Sermo than I've ever learned from recertification, and I've been certified twice, he says. So love this painting. It's a Rembrandt, The Anatomy Lesson of Dr. Tulp, dating from 1636. This is how doctors learned in the old days. They learned probably by candlelight in some exclusive learning center, and only a privileged few got to learn from the masters. Another great painting, this one from Thomas Agnew, dating 1875, of doctors learning in the medical amphitheater. And the amphitheater evolved, of course, and learning evolved. But the real breakthrough in how doctors are learning and influencing one another is happening at this very moment in time, where doctors don't just rely on the words of a few important key opinion leaders. They don't rely on sometimes outdated textbooks, or they don't wait for months or years for peer-reviewed publications or controlled clinical trials that don't always reflect real-world medicine. Today's doctors are actually learning from one another every day through the magic of being interconnected through technology. That's what we call medical crowdsourcing, and today here's what that looks like. Very simple. Roughly 85% of doctors are on mobile devices. So that means in real time, direct from the exam room, they can take snapshots of a patient case, and note they're doing this without identifying the patients, of course, because of all the strict HIPAA regulations, right? You're just taking a picture of the ulcer in this case. They post them on Sermo, and they ask for feedback and advice, and they get that immediately. So there are no cumbersome medical forms to fill out or patient information to exchange, no EMRs that don't speak to each other anyways. It's simply a quick question over mobile, and the ability to get so much feedback in real time is just incredible. And you're getting that feedback not just from doctors in the same specialty, but across different specialties. So taking a few steps back to talk about crowdsourcing in general, what is crowdsourcing and why is it so exciting? Two definitions here, one from Merriam-Webster and one from Mashable, but the Mashable one really hits it more squarely on the head. They define crowdsourcing as distributed problem solving. By distributing tasks to a large group of people, you're able to mine collective intelligence, improve quality, and work in parallel. And so the benefits are clear, right? When people work in parallel to accomplish a task in real time, they build on each other's idea. So the outcome or the solution far exceeds that of the individual. And that's the power of human computing, and that's tremendous. And I just thought I'd share with you some real-world examples. I use Waze. I don't know if you guys know Waze. It's a new GPS at an Israeli company. Love it, absolutely love it. Waze took GPS to a whole new level, making it far more valuable to drivers by not just telling you how to get from point A to point B, but by using social, by using the community to point out issues on the road, so that Waze can actually change the route accordingly. So on Waze, people contribute in real time. They report traffic, speed traps, accidents, potholes, police, and all that stuff. You know, at first I was pretty skeptical about a social GPS, like really who wants to do stuff while they're driving on a mobile device? It sounds contradictory, but I use it all the time now, and to date the company has amassed 50 million users globally, and Waze was acquired by Google for $1.3 billion in June 2013. So that's quite a success story. The Boston Marathon and Amber Alerts are another great example of crowdsourcing in law enforcement. After the Boston Marathon bombing in 2013, the FBI asked the public for help in providing clues on the whereabouts of the suspect, and that ultimately helped lead to their capture and arrest. The Amber Alert is another example. The Amber Alert began in '96, and by 2005 it was being used in all 50 states. The Amber Alert helped save the lives of 685 children nationwide, so very, very successful. And of course, you know, we'd be remiss without talking about Wikipedia. I mean, that's the most famous example yet of the power of the human collective. It's really a wonderful knowledge bank. Another example, actually, that I just thought of was when we rebranded Sermo, we held a crowdsourcing contest for our logo. And within about a week and a half, we had 690 designers from the entire world participating, and they provided 2,000 design or logo iterations. And that was truly incredible. And we had some wonderful, wonderful designs, and in the end we ended up choosing one. But the level of participation, the level of creativity, it was just wonderful to see something like that. So let's go back to medical crowdsourcing on Sermo. Here's a closer look. So this, everyone, the way I see it is this is the medical amphitheater of 2015. You see a doctor asking for help with a diagnosis from his trusted crowd of peers. And you know what? Just the fact that he's even asking for help is significant in and of itself. Because of liability issues, so many doctors wouldn't do this. But on Sermo, many doctors choose to be anonymous, and that enables them to reach out without fear of repercussions, without ego, and to be able to do something like this. And this doctor here, you know, also asked his peers. He created a poll, and he got multiple comments. And here he's got 84 responses, so even a quantitative guidance as to what to do. Should I do a liver biopsy, send the patient to a tertiary center, an ultrasound? So you've got 84 doctors in the amphitheater with this doctor helping him. We get this question all the time, and the question is, you know, why are doctors doing this? They're so busy, they barely have time to do anything, and you're not paying them, they're not being compensated, so why are they solving cases? And they do this essentially for the very reason they decided to become doctors in the first place. They do this for the fun and the passion of practicing medicine, and they do this to help their peers and to help patients ultimately. And this one doctor says, medicine is fun when it's without the intrusion of all the third parties. The other very, very important reason they do this is, and this may sound obvious, but you know, because there are close to 13,000 known diseases It isn't possible for any one doctor to know every condition, every symptom, right? Unfortunately, Dr. House isn't real and medicine isn't clear-cut. So crowdsourcing has proven beyond a shadow of a doubt, I'd say, that a large group is smarter than any one individual or even an expert. There's power in numbers and there's wisdom in crowds. And I really can't think of a more important application for crowdsourcing than medicine. Let's talk about the gray zone. What is the gray zone? Well, the gray zone for doctors is a zone where they're simply not sure of the answer or the diagnosis, where they would like the feedback of a peer. To me, the gray zone is fundamentally the underlying need for medical crowdsourcing and the raison d'etre. So to what extent is lack of clarity on a patient case a real issue? Why does it happen in the first place? What are the consequences? How frequent is it? Let's talk about why it happens. It happens for two reasons. And it's not a question of competence. There are great doctors out there, but I think we'd all agree that we're living in an incredibly fast-moving world. And because of that, doctors are increasingly working and making treatment decisions alone with the facts and experience available to them in the moment and with very little time to collaborate with peers. Remember the empty lounges out there. They've got to make decisions. Boom, 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 right? The second reason is diseases in people are complex, right? There's often comorbidities. There's patient compliance issues. There's questions that require the perspective of multiple specialists. So it's not just a question for one doctor, but often one doctor is the one that has to make the decision. So let's look at frequency. We're actually currently conducting a poll. We're so fascinated with the gray zone question that we're conducting a survey with our doctors around the world, and we've asked them how many patient cases are in the gray zone where you would like the advice of a peer. And to date, we have more than this because the poll is ongoing, but close to 3,300 doctors. And what we found is that virtually all doctors, 99%, say they have patient cases that are in the gray zone. The majority say that they have at least 20% of their cases that are unclear and require feedback. In the G5, we found that number to be 87% of doctors saying they have 20% of cases in the gray zone. In the U.S., it was about 75%. But, if you look at all the stats, it's fascinating because you've got an 11%, a segment that say that they have 30 to 40% of cases in the gray zone. Another segment, which is close to 10%, also say they have 40 to 50. I mean, that's just huge. And again, medicine isn't clear-cut. And we're just starting to understand why that is. It isn't a question of competence. It's, again, a question that no one doctor can know everything. So what are the consequences of isolated decision-making? The consequences are misdiagnosis. And misdiagnosis is serious and it's common. 10 to 20% of cases are misdiagnosed. 28% of those diagnostic mistakes are life-threatening. Each year, you get about 40,000 fatal diagnostic errors in U.S. intensive care units. That's actually the same number of breast cancer deaths per year in the U.S. So that is really tremendous. I mean, the consequences of a misdiagnosis could not only damage a patient's health, it costs money to the patient, it costs money to the healthcare system, but if it could even cost a life. So doctors are now taking it upon themselves to break down these silos, and they're reaching out to their peers to help make these sometimes life and death decisions. So to give you an idea of the impact and importance of medical crowdsourcing, we've collected a few stats for you on Sermo. So on average, doctors spend 45,000 hours a month on the site. Over the last year alone, 3,500 challenging patient cases were posted, and actually We only started measuring this a few years ago, and since I believe 2011, 2012, and that's 5,000 patient cases. But there's a tremendous number of patient cases that are being posted and increasing. This is another fascinating stat that I love, and it answers how does crowdsourcing actually benefit patients in healthcare? Well, each patient gets approximately 200 years of medical experience at zero cost to the patient or the healthcare system. And the way that's calculated, there's a minimum of 10 doctors with roughly 20 years of experience per doctor on each case. That's how you get the 200 number. And each case gets at least 14 comments and is viewed 230 times. So to us, the power of all that expertise is astounding. And the other thing that we feel is astounding is the speed at which this happens. When a case is posted, doctors will usually respond within an hour and a half. And most cases get the input they need in less than 24 hours. So compare that to the real world where a patient has to go for multiple tests to clarify the gray zone and multiple doctors for second and third opinions, the energy, the time, the cost. On Sermo, there's always a specialist in the house, and she's always ready to respond. So finally, why is this important to pharma and to audiences that want to engage with doctors? I take you back to the medical amphitheater concept. There is a really important multiplier effect that happens when one case is posted. It's viewed and discussed by many. This is where the learning and the influence happens, and this is where the magic happens. So these patient cases were viewed 700,000 times and received 50,000 comments, those 3,500 patient cases. That's amazing. That is a real multiplier effect. And so there's a new phenomenon here that's important, and we call it the rise of the new KOL, and we've termed it the every doctor KOL. The every doctor KOL is the one that has the answer and experience at that moment in time and can influence all his peers who are in the amphitheater with him. Just like a small pebble thrown in a pond, the ideas and the influence spread, and they spread by everybody. The every doctor KOL is fascinating. He wants to hear from others. He wants to get challenged. He wants the wisdom of the crowds. That doctor combines accepted medical research with his years of real-world anecdotal experience, as well as the opinions of his peers to arrive at the best solution or the best crowdsourced answer. The every doctor KOL is the one in the trenches. He's the one who sees real-life and real-world patients with comorbidities and complex problems that aren't addressed in clinical trials. So we believe it's important for you to understand the dynamics of how doctors are now influencing one another. And as we all know, the most important influencer of doctors are simply other doctors. And finally, the stats I just shared with you, the medical crowdsourcing stats, are just our U.S. numbers. When we grow Sermo, when we grow our network globally, this type of collaboration and peer-to-peer influence among doctors will only increase exponentially. We're incredibly excited to be at the forefront of this movement, and we're very excited about so many other applications of crowdsourcing on the Sermo platform. So thank you so much for your time. This concludes my presentation, and now I'll open it up for questions. So Larry, I'll hand it over to you with any questions from the audience. Thank you, everybody.
Right. Hey, terrific. Thank you so much for that. Yeah, we've got a couple questions here, and certainly we'd like to invite everybody to submit a few more. First one is, you had mentioned over the course of the presentation about some of the other professional networks for doctors. How would you differentiate Sermo from the competition?
Okay, that's a great question. Thank you for that. Actually, I'd say that we don't have any direct competitors. Yes, there are other online networks, but there are no other true high engagement social networks in our space. So we differentiate in a couple of ways. So first, if you look at other networks, we all operate in different spaces and offer different things to doctors, right? So just as we use mainstream social media for different purposes, like we use LinkedIn to connect, Instagram to show off pictures, we use Facebook to engage, to share what matters to us with the people that matter to us. Doctors they're starting to do the same with professional social media, right? So, for example, Figure One, they use that for picture entertainment. We call it medutainment. It's kind of like the Instagram for doctors. Whereas Doximity, another professional network, is a lot like LinkedIn. It's really the doctor's professional online resume, and it's more of a one-on-one network where doctors are pretty much recruited for jobs. So I'd say if you look at that spectrum, Sermo is really much more like a Facebook, where doctors really engage, both personally and professionally, and they engage with many, so as opposed to the one-on-one aspect of Doximity or like the one-on-one aspect of LinkedIn. So Sermo really is unique in the sense that it has that amphitheater aspect, and that aspect, the ability to broadcast to many, is really the aspect that enables medical crowdsourcing. And you need that, and you need numbers to scale to make crowdsourcing happen. And two doctors sharing a patient case over email privately, that is not crowdsourcing. And the second and important way that we differ is that we're only open for doctors, whereas the other networks are open to other healthcare professionals and even to the public. So we keep Sermo strictly physician only, and our doctor identities are triple verified. And then lastly, there's one other way that we differentiate, and that's anonymity. The other big difference between Sermo and other networks is that most of our doctors voluntarily actually choose to anonymize themselves. And that's very, very important because anonymity is what really drives engagement. Recall what I said previously about liability. Doctors are pretty paranoid creatures, right? Like, why say something that's going to be discoverable? So anonymity really allows doctors to be honest, open, to ask for help, to offer help, and to say what they really think, right? That doesn't happen on a network where a doctor is identified like Doximity, because that's where they have to be their professional self. Very much like on LinkedIn, I'm my professional self. So that's pretty much the three reasons. The three ways that we differ from our competition that we don't have.
You know, it's interesting. Over the course of that response, you touched on something which is another question that's come in from the audience. You mentioned how doctors' identities are triple kind of verified, but a lot of them choose for anonymity. If you have doctors choosing to be anonymous on the network, how do you truly know that they are real doctors? What are the standards put in place to make sure that everybody here is a doctor, does have that experience?
That's actually a great question. We get that question all the time. So as I said, trust and security for doctors is really the hallmark of Sermo. It's so important for doctors to feel that they are among doctors and nobody else in the audience. So verification is actually critical for us, and we verify our doctors in three ways. First, we verify that they're real people via their Social Security number. Second, we verify that they're real doctors via their medical license. And lastly, we use really a best-in-class ongoing verification system that's used by financial institution each time the doctor logs in, so that we know that it's actually a doctor. Does that answer your question?
Oh, absolutely. And actually, something else which I thought of, and both in that answer and also what you were saying about the amphitheater aspect in the answer before. Give me sort of a snapshot of what doctors do day to day on Sermo. Why do they find it so compelling? Why do they find it so useful? Give me kind of a snapshot of a day in the life for a doctor that's spending a lot of time on Sermo.
Absolutely. I'm going to give that question to our Director of Community, who is with the doctors each and every day. He moderates, he listens to them, and he really has his pulse on the finger of what is happening. So that's Christian Rubio.
Hi there, this is Christian. Yeah, so the community the network really is one that the doctors log in thousands of times a day, and the interests are diverse. I mean, the discussions tend to split between clinical and non-clinical discussions, much as you would see in the doctor's lounge in a hospital. And the discussions are often specialty-based, but there's also quite a bit of interest by doctors across specialties. They want to talk to their peers as they discuss complex cases that bring in a variety of backgrounds. So you might have some debate about the planned diagnostic path for a patient on one clinical case by people from 3 or 4 different specialties who may see the different aspects of a given disease state. But then at the same time, you might also have them discussing topics of the day that are related to policy or practice management or health IT trends. So you really get a mixed bag. It's a passionate discourse. Doctors are passionate about what they believe in. They trust data, and so they will get into debates about data sources, and they really challenge each other and respect the doctors who bring fresh data or fresh insights to the existing dialogues. They're on all day, late into the evening, because we all know doctors don't keep the most regular hours, and 7 days a week. So it's really it's a vibrant network that's kind of always on.
Another question that popped in, I think probably in response to the answer to one of our first 2 questions. Tell me a little bit about how Sermo is different from CrowdMed. Tell me about some of the distinctions.
Sure. So CrowdMed is another great platform for medical crowdsourcing, but it's actually a platform for patients to post difficult cases to doctors, whereas Sermo is really a pure doctor-to-doctor. Also, as I mentioned before, for crowdsourcing to work, you've got to have scale. You've got to have massive numbers. You've got to have a large membership. So CrowdMed it's a much smaller platform. It has less than 3,000 doctors, whereas Sermo has 343,000 doctors. And the other part is CrowdMed, 82% of their members, if I remember correctly, are not actually doctors. They're the general public, medical students, nurses. I have an account. Anybody can create an account. So anybody can help solve cases, where on Sermo it's really, the collective power of physicians and physicians only. There's also another difference in the sense that in terms of motivation. So on Sermo, doctors are solving cases because they enjoy it and they want to help their peers, whereas on CrowdMed, patients are paying doctors, and therefore doctors are getting compensated essentially.
A question about the future of Sermo. Let's say we're having this conversation, we're doing a webcast again 5 years from now. Tell me about how Sermo might evolve. I'd like to actually combine that question with something asked by somebody in our audience. Do you believe that the Sermo platform will significantly improve health outcomes in the future?
Absolutely. So absolutely to the latter part of that question, and I'll answer the first part of that question, which is, where is Sermo going to be in 5 years? What is our vision, and how are we going to make that vision happen? So this year is an incredibly exciting year. It's the year of our global expansion. We're going to be expanding into 10 more countries. So in 5 years, Sermo will undoubtedly be the first true global social network of scale. And doctors are, they're finally going to have something that they truly need, and that's a global place for peer support and instant access to expertise. And that, this access to expertise is not just in their own country, but across geographies and across healthcare systems. This really is unprecedented if you think about it. Doctors do not talk to one another across geographies. They live within their own healthcare systems. So we really feel that Sermo will become one of the most powerful platforms in medicine. And we imagine it to be not only a platform for pharma to reach doctors, but there are so many other medical audiences who want to engage with doctors or who want to access the collective wisdom of doctors to challenge to solve challenges in medicine. So, we talked a lot about crowdsourcing, but it's still early days for medical crowdsourcing, and we've yet to see new applications. But I can tell you that we're being approached by many groups who understand that we represent a unique collective, and they want to leverage that. They want to leverage that collective expertise of doctors around the world.
Okay, I'd like to go to a couple more questions from the audience here. Thank you for all the actually very thoughtful and wonderful submissions. We have a question. How many U.S.-based physicians are engaged in the Sermo amphitheater?
We have a membership of 305,000 physicians in the U.S.
Logically. Do you find that doctors on Sermo are also on other physician social networks? Is there duplication? If so, what is the duplication?
Absolutely. So just as I am on LinkedIn and I'm also on Facebook and Pinterest, doctors can be on multiple networks because, as I mentioned previously, those networks offer different things. So Doximity is a LinkedIn. You want your professional profile up there, but that's not really where you're going to be engaging with other doctors. It's your identified profile. It's where you get a lot of recruiters contacting you. It's really more of a job thing, and you're really your professional self. So Sermo is really where you want to engage, where you want to talk with other doctors. Figure One is kind of like the Instagram where, you see this unbelievable medical picture and you just got to share it with people. So you can absolutely be on multiple networks at the same time. I can't tell you what the cross-section is. I don't have those stats. But there is overlap.
Okay. We have another question from the audience. He's asking if you could elaborate on some of the opportunities for industry to become a part of the doctor conversations that are taking place every day on Sermo.
I will start that question and then pass that over to our head of engagement, Kim Frederick Schneider. But, basically we're seeing so much interest from pharma recently coming in since the relaxing of the FDA social guidelines. And what we're seeing is that pharma is finally wanting to get into the conversation, get involved in the conversation, get ahead of the conversation, as opposed to just broadcasting via billboard in a kind of unidirectional way. They want this to be a two-way conversation. So with that, I pass it over to Kim.
Thanks, Osnat. I'll try to be brief, but this could be another 3-hour conversation just about this. I think that what's interesting to note, to sort of pick up on what Osnat was talking about, is again this idea that of the unique nature of the conversation and the environment of Sermo, that it's not a place where your traditional display is necessarily the right approach. It's an environment where the time on site, the level of engagement is really unprecedented, and formats for engagement which take advantage of that are certainly the most effective. So we have clients, for example, who will bring in KOLs, who will have webinars, who will bring in patient cases, who are bringing in innovative clinical content, and who are also making a name for themselves as innovators by sponsoring, for example, a particular disease area or therapy area within Sermo. And we see that with pharma, but we also see that with a lot of associations. And so that it really is, it's a unique environment, and it's one that, as Osnat was saying, people are increasingly understanding that it is an area that can be very powerful and very effective because of the peer-to-peer influence that's going on there, but that it needs to be approached in a way that's different from traditional digital. Yes, we can say that these days, traditional digital approaches, which are much more unidirectional and much more just sort of passing information out. I'd say the sort of benchmark, as I usually put it, the benchmark is if it doesn't talk back to you, it's not social. And certainly what we do always provides feedback, quantitative or qualitative feedback, but it really is a conversation rather than this one-directional throwing up of information.
There's actually a follow-up question, which I think you could probably answer as well, Kim. It's actually from somebody who works for a pharma company. He wants to ask, he'd like to know an example of how the pharma industry can leverage Sermo.
So I think I went through a few of those again with things like sponsorship of a disease state and patient cases, KOL, bringing KOLs to bear. Again, anything that, I mean, we have a number of examples. I can't sort of, obviously for obvious reasons, I can't go into details on everything. But what I would say in general is if what you're trying to do is simply keep your name out there or increase awareness of your brand name, Sermo is probably not the right option. So there are people, who are going to give you that 90+% coverage of doctors, and if you just want to get something in front of their eyeballs, there are better options. For anything that's unusual or innovative or takes more time to explain, or where you're really trying to change behavior and engage with physicians in a deeper way, then there are many examples that we'd be able to share in more detail one-on-one with people of the way that this sort of social environment really changes minds. And really opens people to new ideas and new possibilities in a way that traditional display does not.
Okay, another question here, very thoughtful question. Is there data that support how doctors are now using these online social communities for them to connect and consult with peers on clinical decisions, as opposed to the usual, call somebody up, get the decision that way?
Sorry, the data to support how they're doing it or the impact of it?
How they're doing it versus just using the phone, picking up the phone and getting an answer that way.
Right, so we actually showed some of that data, which is, how many times patient cases are being shared, how many years of experience are per patient case, how fast a case is solved, and the most interesting one is what I call the multiplier effect, which is how many times that case is viewed and how many comments it receives. So the whole, the pool of influence from these cases. So, the data that we don't have is if you didn't crowdsource this, it would cost you this, the kind of economic analysis where how do you compare that with the real world versus this? What is the value of crowdsourcing versus the real world? So we do not have that, but that would be fabulous data to go after because it would complete the story.
Actually, almost an administrative type question here. Do you have nurses and medical students or residents Sermo require a membership fee?
No. Sermo is free for doctors. Absolutely.
Let me just jump in quickly. This is Kim again on the previous question about nurses. Just want to clarify that we provide fieldwork services. We're actually the largest provider of fieldwork services for market research in the healthcare space, and we have a research network that does include nurses and other healthcare professionals. But the Sermo social network is exclusively for physicians.
That is true, yes. So we do have two sides of our business, and within the social network itself, as Kim was saying, it is purely physicians. Within the research network, we have other healthcare professionals.
Here's a question. I think actually it might have touched on briefly during the conversation, but are physicians on Sermo paid to contribute? And if so, how do we know that their answers are authentic and, basically pure, for lack of a better way to put it?
I'm going to let Christian answer that one. Christian?
Yes. Hi. The physicians are part of a larger community in which we keep a lot of engagement going through contests and promotions that are very organic and fun for them, challenges, etc. But when it comes to actually paying for engagement, we don't do that. We don't go that far. It's really about what really drives their interest is the camaraderie and the collegiality they share and the insights they gather from each other. That's really most anything that could possibly be compensated would be purely for fun factor, if that makes sense.
Okay. Here's a question about some Sermo members. The loyalty. Obviously, there's a degree of loyalty you see with Sermo that you don't see in too many other online communities, both through medicine or in any other area. Why are Sermo's members so loyal? Why has this community thrived where so many others have kind of petered out?
I'll take a first stab at that, and I'd love to hand that over to Christian. He's been with the community for a while. But I only joined the company about a year ago now, and it was fascinating for me to see that this social network was a decade. It was 10 years old and never had any marketing, never had any outside marketing, and yet it had this incredibly loyal fan base of physicians returning to it and sticking to it. I wish I had some other quotes for you from physicians, but so many of them are addicted to, say they're addicted to it. It's just the ability to connect and to hear other people and other doctors talking honestly, and the friendships that they make online and the things that they learn. It's really a completely unique environment. So it's very different from environments where doctors are, it's just kind of like a news channel, kind of like a Medscape, where there's a lot of great information and a lot of educational information, but it isn't interactive, right? It's very different from a Doximity where, again, it's kind of like a LinkedIn, but there's not a lot of engagement going on, right? So I think those are some of the ingredients that make it incredibly unique. And Christian, if you want to add anything to that.
Yeah, no, I think that's a great way of putting it. I think a lot of what has driven the loyalty over the years was that Sermo was originally the social networking component. The site itself was started by doctors, but over time and through mergers and as we've grown into this global platform, we've never really stopped being a sounding board for them. So as the community team and as we continue to steward engagement with them, we've always kept the physicians first to make them feel like not only are they heard, but they're advocated for. And we've kind of built this bullhorn of a platform for them to express themselves. So as a result, they not only are collaborating with each other, but they're now starting to understand that, yes, this is a long-term view, that they're going to be part of a global network that connects physicians around the world to build consensus their way into interacting with industry. And really, as a result, they are kind of opening themselves back up to a lot of dialogue that they might have backed away from in recent years as they felt the ground shift under them when it came to regulatory changes in approach around them by whether it was administrators or anybody else that might have kind of fueled the what Osnat referenced as kind of them being angrier these days. And as a result, I think the loyalty is just as much about this greater sense of connectedness that we've been actively growing with them in the last couple of years. Results being now they are about 67% more engaged, our actives are, than they were a couple of years ago. And we're seeing more engagement at different levels of interaction. So whether it's voting on polls and voting on even the industry polls and the kind of specialized areas of the site that are dedicated to specialty discussions or specialty-specific discussions or disease state discussions, we're seeing kind of across-the-board lift and engagement that we expect to really give us extra lift as we go international.
You know, it's interesting. You mentioned in your answer something from earlier in the presentation about doctors being angry, and we actually have a question about that. Doctors being angry today. What do you find from what you see in the site and from anything else? What do you find are the leading topics of their discontent? What are they angry about?
Oh my goodness, certification.
where to start, right?
Where to start? Yeah, I'd say meaningful use and certification and electronic health records and less pay, and I'd say those are the big topics, Christian.
Yeah, I think certification is certainly at the top of the list. Not necessarily the need to be certified. That would be, that's it's not that extreme. It's more just they are really pushing hard for certification reform and maintenance of certification reform, and also I think through the course of the Affordable Care Act implementation and the rollout of many changes, kind of sea change for them, they've felt like they were not properly included in the process, either as a result of associations and the American Medical Association maybe playing more ball with an administration than they thought, or simply not being organized enough themselves. So that was a big part of it. But outside of the politics, I think they've also felt an erosion of their importance in the value chain when it comes to industry and hospital decision-making and financial decisions. So, and as a result, more doctors are becoming hospital employees or network employees, and they feel, okay, even less now do they have a voice as individuals. So one of the interesting trends is also that if you think about a global network of physicians, so many outside the U.S. are in areas or in countries and regimes in which there's more privatization going on, which is also a sea change for them. So the fact that we're connecting populations across countries, they're sharing standards of care, they're sharing clinical insights, but they're also sharing their frustrations that are not necessarily that different, because a lot of the changes being made all over the place have to do with not enough time spent being with a patient, or miscommunications, or a technology breakdown. So there's really ample opportunity to learn even more about what's frustrating them, not just in the U.S. today, but elsewhere.
All right. Terrific. I think we've reached the end of our time here, so I'd like to thank Osnat, Kim, and Christian for this incredible presentation. I'd like to thank everybody for tuning in and listening, and especially for some of the very thoughtful questions. This webcast will be available online at our website, mm&m.online.com, -online.com. I should probably know that. And thanks again. Please come back for our next webcast. I believe there's one coming up next week. Thank you, everybody.